have the patient lying supine with their shoulders abducted to 90 degrees, their elbows at 90 degrees, and their forearms resting on the neck table. The patient can provide their own stabilization of their trunk, but if needed, you can stabilize at the anterior portion of the trunk and palpate for the muscles at the anterior portion of the neck. Next, you'll bring the patient into full passive range of motion, making sure to first tuck the chin and bring him to full flexion. Once you know the passive range of motion, have the patient bring their neck up as far as they can, palpate for the muscles, and provide resistance at the forehead. To test anterolateral neck flexion, you'll have the patient in a similar position with their shoulders abducted to 90, elbows at 90, and forearms resting on the table. You will have the patient turn their head contralateral to the muscle being tested, and then you can palpate for the sternocleidomastoid on that side. If needed, you can provide stabilization at the anterior portion of the trunk. Before beginning, you'll bring the patient through full passive range of motion. Once you know the patient's passive range of motion, again have the patient bring their neck up, palpating for the muscle, and then providing resistance for 5 seconds on the lateral portion of the head. To test neck extension, you have the patient prone on a table with their shoulders abducted to 90, their elbows at 90, and forearms resting on the table. To test passive range of motion, you will first stabilize at the upper trunk and bring the head into full extension. Once you have the passive range of motion, have the patient go through the same motion by themselves, palpating for the neck extensor muscles. So go. And provide resistance on the posterior portion of the occiput. To test trunk flexion of the rectus abdominis muscle, have the patient lie supine on a mat table with their hands behind their heads. Make sure that their legs are fully extended and their pelvis is in posterior pelvic tilt so their lumbar spine is in contact with the mat table. If needed, provide the patient with pillows underneath their knees to allow for their lumbar spine to be flat against the table. Palpate the rectus abdominis muscle on either side of the midline. Next, you will assist the patient into full passive range of motion into trunk flexion, at least to the point where the inferior angles of both scapula have cleared the mat table. Next, the patient will attempt the motion on their own as you palpate the rectus abdominis muscle. And then make sure that the inferior angles of each scapula have cleared. If the patient is unable to clear the inferior angles of their scapula with their arms behind their head, have them cross their arms across their chest and perform the test again. If their inferior angles are not cleared with the arms across the chest, you can relax. Let them place their arms at their sides. And then come up again. Okay. If the patient is not able to clear their inferior angles with their arms at their sides, take a look at the degree of the scapula or the cervical spine that is raised and cleared the mat. An alternative test for trunk flexion is called the leg lowering test. Having the patient lie supine on a mat table with their arms crossed across their chest, and you will have them bring their legs up to hip flex 90 degrees and knees extended. So I'm instructing the patient to keep their lumbar spine against the mat table and palpating that while lowering their legs towards the table. Okay. And then for the test, you will have the patient perform the same action by themselves while palpating for the rectus abdominis muscle. lower their legs slowly. Make sure that their lumbar spine is pressed against the table and does not become arched. So the clinician will cup their hand underneath the patient's lumbar spine to see if the patient can maintain that contact against the mat table. And then if any time you feel an arch in their back and it lifts off of your hand, you're taking note of the approximate angle of the patient's leg at that time. So if the patient is unable to maintain the starting position, but you feel that contraction in the rectus abdominis muscle, the score would be a 1. If the patient starts the test and loses that posterior pelvic tilt at 75 degrees or more, then the score is a 2. At approximately 70 degrees, the score is a 3. And at approximately 60 degrees, the score is a 3+. At 45 degrees, the score is a 4-, and at 30 degrees, the score would be a 4. To test trunk rotation of the oblique muscles, have the patient lie supine on a mat table with their legs fully extended and their hands behind their head. Palpate the oblique muscles on the lateral portions of the anterior trunk. You will assist the patient through full passive range of motion by bringing them to trunk flexion and rotation to the point where both inferior angles of the scapula have cleared the mat table. You will then stabilize the patient's legs in the anterior thigh and palpate the muscles of the other hand and have the patient perform the action. Take notice if the inferior angles of both scapulae have cleared the table. If the patient is unable to clear both inferior angles of their scapula with their hands behind their head, they will instead cross their arms across their chest and then perform the same action in this position. If they were still unable to clear the inferior angles of their scapula, have them place their arms at their sides and not perform the same action. For gravity eliminated position, have the patient seated on the edge of the mat table, making sure that their hands are not pulling on the table. You will help perform passive range of motion by rotating their trunk fully. And then for the exam, you will stabilize the patient's pelvis and palpate the muscle and have them rotate in the direction away from you. To test trunk extension, have the patient lie prone on a mat table with a pillow underneath their abdomen and their hands behind their head. You will assist the patient through full passive range of motion, clearing the xiphoid process of the sternum from the mat table. And then you will stabilize in the back of the posterior thighs or pelvis, and you're palpating the erector spinae muscle of the lumbar and thoracic spine. Have the patient again perform the action of extending their trunk. Take notice if they are able to clear their full sternum through the xiphoid process from the mat table. If the patient is not able to clear their xiphoid process from the mat table with their hands behind their head, have them fold their arms behind their back and perform the same action. And if they are unable to clear their xiphoid process in this position, have them with their arms at their sides. And go ahead. And if they are unable to perform in this position, take attention of the degree that their sternum clears the mat table and if a palpable contraction is felt. To test pelvic elevation by the quadratus lumborum and iliocostalis lumborum muscles, have the patient lie supine on a mat table with their feet hanging off the mat, the side to be tested slightly abducted. The quadratus lumborum muscle might be palpated above the posterior iliac crest on either side. To take the patient through full passive range of motion, assist them in elevating their pelvis on one side. Provide your resistance in an inferior direction, stabilizing the patient above the ankle joint. So go ahead. Grading for pelvic elevation is slightly different than standard grading for MMT. So you're paying attention to whether the patient can perform pelvic elevation against maximum, moderate, or minimum resistance, or whether full active range of motion can be achieved without resistance, or if you feel a palpable contraction, even if no movement occurs.